Hi, my name is Dr. Ilana Gurivich, and I am a naturopathic physician, licensed acupuncturist, and a board-certified naturopathic gastroenterologist. And today we're going to discuss how to help support your patients during the holiday season so they can optimize their digestion as much as possible during this time of year. I'm going to share my screen, and we can start diving in and talking. I titled this talk Gut Instincts, Navigating Common GI Complaints with Strategic Supplement Use. The reason for that is because this time of year, it's really easy to have problems with digestion. And so it's great to know what tools we have in our toolkit so that we can help patients feel better during this season. So what's the problem we're discussing? The problem is maintaining a healthy and functional GI tract during the holiday season is hard, maybe even impossible. This is the time of year where it's easy to make poor dietary choices and it's easy to feel uncomfortable. And so strategizing to improve our both our functional eating habits and also knowing what tools we have in our tool belt can really help people just feel more comfortable. It's very, very easy to excessively partake in too much alcohol, too much eating as a whole, way too much sugar. And then greasy holiday foods are just difficult to say no to because they're comfort foods. And let's be honest, they're also delicious. The goals of the talk is to educate about really common basic GI complaints that your patients are going to come in discussing. Dyspepsia and indigestion are how we're going to frame this talk. And these are just generally the huge categories that patients generally suffer with during the holidays. We're going to discuss the role of diet within these complaints. We're going to talk about strategic supplement options. And then we're going to emphasize using an individualized approach for patients so we can really gear treatments to what they need. Let's start by discussing functional dyspepsia. Symptoms of functional dyspepsia include gnawing, burning, aching pain, a feeling of fullness of bloating when the patient hasn't even eaten or has eaten a small meal, excess belching, excess burping, nausea, vomiting, regurgitation. Stomach contents can even come back up into their mouth or throats because there's so much laxity of the lower esophageal sphincter and they suffer from reflux. There are definitely dietary causes that are part of the problem, or maybe even more than part of the problem. Triggers can vary from person to person, but there are some common trends that we see that affect most people. The first one is larger meals. Overeating or consuming large meals can put additional pressure onto the stomach and increase the likelihood of acid reflux or discomfort. Spicy, greasy food. High-fat foods can relax that lower esophageal sphincter, allowing stomach acids to flow back up into the esophagus. Fatty and fried foods or foods that are high in fat take a longer time to digest and can delay gastric emptying, which potentially can cause indigestion. There are certain foods that are just known triggers to a lot of the population. One of them is citrus foods, like citrus or tomatoes. These are acidic foods, and they're known to irritate the GI lining and the esophageal lining for lots of people. Onions, garlic, and other alliums can increase fermentation within the stomach, which can lead to excess gas production and put more pressure on the GI tract. Brassicas, like cabbage, broccoli, cauliflower, and kale, can produce excess gas within the GI, potentially leading to bloating and discomfort. And then sugar, everybody's darling sugar. Sugar and sugary foods, sugary beverages can basically increase the risk of gas and bloating. Processed sugars are readily available for the small intestine to break down and cause fermentation, which leads to an increased gas and bloating sensation. High sugary foods and highly processed and ultra processed foods are high in simple sugars, and this can also delay stomach emptying and lead to a feeling of fullness or discomfort. It's important to recognize that, the stomach, if there's excess gas there, there's a belching that you can happen to release that gas. In the large intestine, if there's excess gas, there's a farting to relieve that pressure. In the small intestine, you've got a valve in the top and a valve in the bottom. That's important because if those valves are intact, then what you end up having is a lot of trapped gas. That trapped gas leads to bloating. That bloating leads to pressure. It can lead to pain. It can lead to a sensation of fullness. And if there's a high load of fermentation that's happening, it's just not easy to pass. And that's that food stagnation that we refer to in Chinese medicine as a problem that just feels uncomfortable. And then I do want to bring up chocolate. I mean, I don't want to bring up chocolate because it's one of my favorite foods in the whole world, but chocolate is high in caffeine, sugar, and fat. All three of those have been shown to worsen dyspepsia symptoms. And so patients will often, once you discuss the common food triggers, will kind of see the patterns or admit that they've noticed that these foods are triggering them. And you just bring awareness to them so they can make choices and, understand what the foods are going to do and make a decision if they want to deal with those symptoms. Coffee and caffeinated beverages also relax the lower esophageal sphincter. They stimulate stomach acid secretion, and they can be a potential trigger for dyspepsia. Excess alcohol and alcohol consumption irritates the stomach lining, which also relaxes that lower esophageal sphincter and leads to dyspepsia and indigestion. And then carbonated beverages. Carbonated beverages are kind of the perfect storm. That carbonation just brings more gas into the intestinal system. And also they're often sugary or caffeinated, which then leads to the delayed gastric emptying and the continued bloating because of that fermentation process that we talked about earlier. It's excessively easy to overindulge in the holidays. What's the solution? We actually have some really useful treatment strategies that we should just know about so we can educate our patients and use them ourselves. If we end up caught in a situation where you don't have control of your food and where it's really easy to overeat. The first product is one of my favorites. It's called GI Soothe. And the first time I heard about this blend was one of my patients said that they were getting a special product out of the UK that had the alginic acid, which she was noticing huge benefit for her dyspepsia with. What GI Soothe is it's a product that's available in the US, and it's a mixture of calcium carbonate and a proprietary blend of alginic acid, prickly pear cactus, and trimethylglycine. It's basically being used to calm and soothe the GI, but also it has protective strategies to prevent that weakening of the lower esophageal reflux or the reflux that happens when you have a weakened lower esophageal sphincter. Let's look at calcium carbonate first. Calcium carbonate is known to neutralize stomach acid. Basically, you introduce the calcium carbonate, which is an alkaline compound, and it will react with the stomach acid. It'll produce water, carbon dioxide, and calcium chloride, and that will reduce the acidity of the stomach. It also offers buffering properties. It will buffer the stomach to help maintain an optimal pH. The buffering capacity stabilizes the acidity and prevents it from becoming too high. And then finally, it'll relieve symptoms by neutralizing excess stomach acids and providing a buffering effect, plus the calcium carbonate to soothe that dyspepsia. And so basically can really work on that burning sensation. The next thing that they put in there is alginic acid. Alginic acid is a product that's made from algae and seaweed. So basically, this is a product made from kelp. And it acts to actually create a physical barrier in the presence of gastric acid. It is really interesting. It is really, really interesting. And there's actually human data that shows efficacy. It's known as an agent to be used specifically for progressed gastroesophageal reflux disease, but it also can be used in functional dyspepsia. What happens is when the alginic acid is ingested, it precipitates upon the contact with gastric acid, and it will actually create a mechanical barrier or almost like a raft-like formation that is used to displace the postpharyngeal acidic pocket. So it floats to the top and it blocks that acid from being able to regurgitate into the esophagus. The formation of that raft-like property will occur within seconds of dosing, and it reduces reflux by floating and foaming to the top. It's more viscous, and so it prevents the regurgitation of any of those acidic contents within the stomach into the esophagus. It is very, very useful, and it works really quickly. The next product that's in here is a prickly pear cactus. This plant has been shown to be an antioxidant, anti-inflammatory, immunomodulatory, and antimicrobial. In clinical trials, it's been shown to offer relief for IBS and dyspepsia, and also it has an effect on the microbiome, which is beneficial. The leaf extract exerts a gastroprotective effect on the gastric lesions within the GI in animal models, and so it can help heal up any mucosal damage that has already occurred. Apple cider vinegar. This is a good one. Apple cider vinegar has a long history of use. And when I mean long, I mean we discuss it in Chinese medicine, we discuss it in Ayurvedic medicine, the two oldest classical medical texts that are out there. And also there are documentation that shows that Roman soldiers drank apple cider vinegar while they were away at war. This is a product that has been around a long time. What it does is it improves gastric emptying, it supports digestion, and it helps with metabolic functioning. You know, back in the day, I mean, back in the ancient Chinese medicine days, we would use it, we would describe it as increasing intestinal vigor. Consuming a small amount of apple cider vinegar prior to a meal can help stimulate the production of stomach acid, which can help in indigestion. It has the active ingredient of acetic acid, but the apple cider vinegar that enzyme science adds to it also includes the mother, which is basically like a prebiotic, or it has prebiotic effects that support the growth of beneficial bacteria within the GI. It helps alleviate bloating after a meal, and it optimizes gastric emptying to just make people feel a lot more comfortable with digestion. They do offer apple cider vinegar as a standalone product in a capsule, and they also offer it added into other products. GI motility is a really exciting product. It has an abundance. The ProDigest has an abundance of animal data that we're going to discuss in a minute that shows really, really good efficacy. And they paired ProDigest. ProDigest is a mixture of ginger extract and artichoke extract. And they paired it with apple cider vinegar. So the ProDigest has a standardized extract of 100 milligrams of artichoke plus 20 milligrams of ginger. That's a standard ProDigest dose. And there's 320 milligrams of that within the product, and then 250 milligrams of apple cider vinegar. This is a prospective, multi-center, double-blind, randomized control trial with a placebo control and also a parallel comparison group of the supplements versus placebo for a 4-week period. So let's just look at this study so we can understand what they were looking at and how effective it was. Patients were randomized to either a supplementation group or a placebo group. They pretty much matched in gender. They matched pretty generally in age. And then they were looking at different presentations of functional dyspepsia. They had an ulcer-like functional dyspepsia, a dysmotility-like functional dyspepsia, which was the majority of the clinical trial patients, and then an unspecified functional dyspepsia. They did an intervention for 14 days, had a check-in, and then continued it for 28 or a month. And what it shows, so we can see that this data right here on the right side of the screen was broken down to the after 14 days and after 28 days. And what we see is a score that measures intensity of symptoms for the supplementation group and the placebo-controlled trial group. The study shows that supplementation with the ProDigest ginger and artichoke extracts was effective in the short term for functional dyspepsia. We do see efficacy within 14 days, and it's maintained throughout the entire 28 days of the intervention. The intervention group showed treatment efficacy measured by a raw score of 0 to 3. We saw treatment efficacy in 86% of cases after 28 days of active supplementation, with a marked reduction in dyspepsia intensity, bringing it down from grade 2 or 3 in 63% of the treated cases. 52.5% of the placebo group showed positive effects from placebo, but only 24.6% of the placebo-treated group had a reduction in symptoms when their symptoms were excessive. And then the other thing that made this study really interesting is they were looking at gastric emptying times. So each evaluation was performed with 10 minutes prior to introducing a meal. They took a baseline area of gastric volume, which was determined by sonography. The subjects were then given one Prodigest or identical placebo, and then they consumed an identical meal of a tomato pasta with grilled meat, chicory with oil, salt, and orange juice. 1 hour after the meal, the gastric volumes were measured again. Gastric emptying was identified as the variation in gastric volume between the baseline and the 1 hour after the meal dosing or amounts. And participants were asked to report any adverse side effects with the procedure or the diet. And then 2 weeks after the completion of the second evaluation, 3 subjects were flipped and they took if they were given placebo, they took the intervention. What is very interesting about this particular formulation is, we've been using ginger in our practice for a long time, and we have a similar complaint from almost all of our patients. It's the complaint of ginger burn. So it feels just like heartburn, but we know it's caused by the ginger. And that's because we are using really huge quantities of ginger and a lot of other standard products. This is a small quantity of ginger, and because it's paired with the artichoke, it has higher efficacy, but really patients do not complain about ginger burn with this product at all. This was also looking at the motility studies. So we were looking at gastric area baseline after meal with Prodigest or placebo. And this looked at the amount of Prodigest that we gave. So we were giving a single dose or a double dose. This is the patient's age and gender. We had a baseline after the meal. And then after the meal, after a double dose, and then the difference. And what we show is pretty good efficacy and higher efficacy with a higher dose. It seems like what Prodigest does is it facilitates gastric emptying, and it is dose dependent. A higher dose offers you higher efficacy. Patients had greater stomach emptying effects when they use a double dose. And then the addition of the apple cider vinegar also increases gastric emptying times and improves digestive vigor so that food isn't sitting in their stomach and being hyper fermented for an excessive amount of time. So that's functional dyspepsia. Let's talk about indigestion, which is similar and different. The way we define indigestion is digestive symptoms that will often include pain, discomfort, could have a burning sensation, bloating, belching, nausea, and an acidic taste within the mouth. Causes of indigestion are very similar to those of dyspepsia: overeating, eating too quickly, consuming fatty and spicy foods, excess alcohol intake, cigarette smoking, and stress. This is the common phenomenon of us in the West sitting and working and shoving our food into our mouth while we're trying to work, and there's no time to offer proper digestion, or the pattern that we're about to go into, which is patients eating a lot of food that's not within their control, that just makes them feel bad. So there are lifestyle interventions that we can educate our patients about. Eating smaller meals. Try to eat when you're until you're 80% full. Sometimes it helps to eat smaller meals throughout the day. Sometimes patients don't tolerate that. And then avoiding food triggers like the citrus, the chocolate, the fatty foods, the caffeinated, carbonated beverages, and then processed and ultra-processed foods. Chew your food thoroughly. Take actual time to chill, rest, digest, and enjoy your food. And then always educate your patients to avoid late night eating. If they want to give at least 2 to 3 hours of food to actually leave the stomach and enter the digestive process before they lay down. And if they don't, it is very common that it will regurge up back into the esophagus. What I really wanted to talk about here is the role of digestive enzymes, because they're very important with our indigestion and dyspepsia patients, and they're nuanced, and we often don't understand how to compare product to product and why we would choose one or the other. So I want to do a big overview on what we do with digestive enzymes. Digestive enzymes play a crucial role in breaking down food and the food we eat into small absorbable components that can be utilized within the body. When there's an insufficiency of digestive enzymes, it can lead to indigestion, and that can lead to impaired ability to properly digest and absorb nutrients. If you get an incomplete breakdown of nutrients, which enzymes are responsible for breaking down carbs, proteins, and fats, If there's a deficiency of any of those enzymes, the food will not be broken down completely. This can lead to larger molecules entering the digestive system, reaching lower parts of the digestive system than they're supposed to, which can cause bloating, gas, and discomfort. Malabsorption can also occur if you don't have a robust enough digestive enzymes. Inadequate enzyme activity can lead to malabsorption of nutrients. When food is not properly broken down, it's absorbed, you can't absorb the nutrients out of it. And so you end up with a malabsorption there. And then undigested carbs and complex sugars, especially if they reach the colon, they can be really aggressively fermented. And that can lead to worse gases, worse bloating, worse flatulence, and lots of discomfort. Incomplete protein digestion can result in the presence of larger protein molecules in the digestive tract, and that might trigger an immunological response and cause sensitivity to different foods that you're not supposed to be reacting to. It can also cause nausea, stomach pain, and diarrhea. We just really never want the proteins to, we don't want the proteins to enter in their complete state, the large intestine. You can also have a delayed gastric emptying. The lack of digestive enzymes may slow down the overall digestive process, leading to delayed gastric emptying and food sitting in the stomach for longer. That can contribute to feeling full, bloated, discomfort, just uncomfortable, and just bad. You know, I always define a healthy digestive system as one that you feel when you're hungry, and you feel when you have to have a bowel movement. But besides that, it's doing its thing and you're not noticing it. So if you're spending a lot of time noticing how your GI is doing its thing, that means there's a problem there. And then there can also be an increased acid production, because if you're lacking enzymes, then the stomach may produce more gastric acid to compensate for the lack of enzymes and try to upregulate the food breaking down. That increased gastric acid content can then lead to heartburn and reflux. Enzymes that are secreted by the body naturally for digestion are lipase to break down lipids, protease to break down proteins, and amylase to break down carbs. Those are generally going to be the foundation of any of our products, and then we will add more enzymes on top of that to further support digestion. When enzymes are utilized, they are specific to a pH, a substrate, and a temperature. And that matters with how you're going to eat. And that is one of the benefits of using the vegan enzymes or vegetarian enzymes, because they're a lot more forgiving. They work a lot more in a much wider space. And so we're not worried so much like we are with the animal-based ones. Vegan enzymes are generally derived from aspergillus, which is a fungus. They're often grown in a lab on some kind of medium. Right now, it's mainly aspergillus. And then they're best tolerated if they're taken before a meal, so they can mix with gastric acid and start working in the stomach. They're not only being used in the small bowel, like a lot of the animal-based enzymes and a lot of the drugs that we have. They have a huge pH window and have efficacy of anywhere from 2 to 12. They start working in the stomach, and they are both utilized for digestion, but also to clean the brush border of the intestinal lining. One of the main sources of enzymes come from aspergillus. Aspergillus will secrete enzymes as part of its metabolic process, and then the company will go through a 12-step purification process that separates out the enzyme from the aspergillus unit. So you're not really worried about your patients who are fungally intolerant tolerating these enzymes, because there's no fungus matter left in them. This is a great diagram of the families of digestive enzymes. So we have the proteases, which are used to digest dietary proteins from animal, dairy, or plant matter. They break down those proteins so that as it comes down the further line, the amino acids are accessible. And they also can break down proteins from invaders like pathogens. Lipase is used to break down digestive fats by animal, dairy, or plant matter. And breaking down these fats and properly processing them can actually help support cardiovascular system, because you never let those fats implant on the walls of the vessels. Amylases are used to break down dietary carbohydrates from fruits, sugars, and grains, and that can help you control blood sugar and also histamine balance. And then cellulases. Cellulases are not endogenous, and this is where like the richness of the vegan enzymes really come in. Cellulases are used to break down all components of plant-based foods. And every vegetable has some cellulases as its main fiber or cell wall. So we use, cellulose as its main fiber. So we use the cellulases to help promote digestion. This is maybe the most useful chart in my entire presentation. I would screen grab this one if you can. This gives you a conversion of how to convert common labeling units to what we're using to USPs generally. If you look at the proteases, amylases, if you're looking at the pharmaceutical version, which is animal-based and carries a higher side effect profile, they're all designated in USPs. So a HUT is equal to about 1 USP of proteases. Lipases, we don't have a conversion. So we convert to LUs or FCC LUs because there is no USP conversion. When I'm discussing vegetarian enzymes, I'm looking at categories like alpha-galactidase, glucoamylase, lactase, cellulase, maltase, invertase, pectinase, xylanase, and hemicellulase. There's lots of cellulase enzymes out there, and they trigger different foods. Enzymes are just a vital part of digestion. You can't live without having enzymes. Patients can be intolerant to fats, to carbs, to animal proteins, or to plant matter. You might have patients that are only intolerant to certain cellulases, but can break down amylases just fine. Different foods will trigger patients differently. So it's important to know your products so you can make choices to target what products patients need. There is not a single one-size-fits-all solution. Different enzymes can be utilized for different purposes in digestion, and they come in lots of different strengths. We're going to start by talking about complete digestion versus critical digestion, just to give you a little bit of a comparison about how you choose to use one versus the other. The complete digestion is a comprehensive full spectrum formula for mild to moderate digestive upset. And the critical digestion is significantly stronger. Here's a breakdown. On the left, we see complete digestion, and on the right, we see critical digestion. This is an apples to apples comparison, and what we're seeing is we're generally seeing that the critical digestion is at least 2 times the strength of the complete digestion all the way down the line. It's important to know that because if you have a patient that only sometimes has issues, or they're worried about just setting themselves up for success, they might not need something as strong as the critical digestion, and so they can get away with something that's A, more affordable, but B, also a lower dose. That's other patients are suffering with this all of the time, and so they really need critical digestion. And then the next product that we're going to look at is a really interesting product called intolerance complex. Intolerance complex is a really complete formulation that triggers many of the known food intolerances that people have problems with. So let's start by talking about lactase. Lactase is an enzyme that breaks down lactose, or dairy sugar. Globally, about 70% of adults are deficient in intestinal lactase, and the enzyme which is the enzyme that's required to break down lactose. In my household, 50% of us cannot tolerate lactose. When we introduce lactase into the mix, it is a disaccharide that is located in the brush border of the small intestine, if you can still produce it, but oftentimes needs to be supplemented for support. When we're talking about lactase deficiency, we have, every human generally is born with the ability to break down lactase. And in fact, healthy infants usually have a high lactase activity. But then as they wean, we see the emergence of these 2 phenotypes, either a lactase deficient phenotype or a lactase persistence. Lactase deficiency can begin gradually, and it can decrease starting in childhood, and eventually can get progressively worse where they can't tolerate lactose into adulthood. The age of onset will vary considerably, and it'll vary between populations. Signs can begin as young as age 2, and low lactase producers will make less than 10 to 15 units of total protein. If you're lactase persistent, lucky you, But these individuals continue to express high lactase activity after childhood. They don't have a problem breaking down lactose. The population has lactase activity over 50 micrograms of protein. And if they have that amount or higher, then they'll be called lactase persistent. Here's a really interesting clinical trial that looked at supplementing with lactase for symptoms of abdominal pain, bloating, nausea, and diarrhea. And what we see is significantly improved symptoms in different doses of supplementation. The next enzyme I want to talk about is DPP4. DPP4 is another brush border enzyme that plays a role in the final stages of breaking down protein digestion before it's absorbed. It's a protease that is known to break down components within gluten into smaller compounds. It allows the gluten to be more easily digested. This is not a solution for anybody who is a celiac patient. DPP4 is not going to help break down gluten to the point that it's going to become tolerant for a celiac. But it is going to help somebody who is non-celiac gluten sensitive, or somebody who just doesn't feel good when they eat too much gluten, and they're not going to know what they're going to be potentially exposed to. So it offers them some protection to help with the breakdown process. It has also been shown to have some activity on casein molecules, so it can also help with dairy exposure. This is a really good breakdown of when to use classical, which is complete digestion, maximum, which is critical digestion, and targeted, which is intolerance, with different meals. And, intolerance complex, you might need to use more of it depending on your exposure. I have a lot of resources that I went through that is completely available for you guys to look over on this presentation. And I'm hoping that it is useful and that we can now offer our patients a really guided supplement strategy and also a diet and lifestyle modifications to make the holidays a little bit easier for them. Happy holidays. Bye.